happy to be here.
Happy to be here. All right. Well, let's go ahead and get this started. We have the first question on the board. Worth 10 points. Question. Name the mechanism of actions for the diuretic thiazide. H.
So it stops sodium and chloride reabsorption. It increases excretion of sodium, chloride, and potassium. And it increases plasma levels of uric acid and glucose.
Judges?
Sounds right.
All right. Ding, ding, ding. She got all 3 answers. Okay. Smart girl. All right. Second question. Name someone who might be taking the diuretic thiazide. Daniela.
Someone who might be taking a thiazide diuretic would be someone with hypertension, edema, or someone with glaucoma.
Judges? All right, the answers are on the board. She got it. Okay. All right, so question number 3. This one's worth 20 points. Name someone who wouldn't use thiazide. Daniela.
Someone who has an electrolyte imbalance or impaired renal function.
Okay. Judges are telling me there's one more answer. Yeah. Yeji.
Dehydration.
Yeji gets the 20 points.
You get 1 point.
Oh. All right, so the next question's worth 50 points. Name the form that thiazides come in. You want me to rephrase the question? You look lost. Yeji.
Most of them comes in oral forms,
Okay.
except for chlorothiazide. It comes in oral form and IV forms.
Okay. All right, she got the answer. Okay, Danielle, you're slacking, girl. Come on, don't you want that right? So, question number 5. The last question before we go to round 2. Name the dosage range for thiazide. Daniela.
Okay, I believe it's chlorothiazide. You would give 500 to 1,000 milligrams a day. Hydrochlorothiazide, you would give 12.5 to 25 milligrams dosage a day. And methylchlorothiazide, you would give 2.5 to 5 milligrams dosage a day.
Okay, she got the answer. I see you there, Daniela. You got your nut. All right, so now
By 1.
all right, so that was the end of round 1. We're gonna go ahead and take a commercial break. We'll be right back in round 3.
Attention, all thiazide diuretic takers.
Have you or a loved one taken thiazide diuretics before? Hyperglycemia, hypercalcemia, hyperuria are all common side effects of thiazide medications. Do not have excessive salt in your diet. This will cause it to possibly reverse the effects of thiazide. Include extra potassium in your diet, as thiazide causes hypocalcemia. Have you gained 3 or more pounds within 2 or 3 days? Call your doctor. This may be a bad sign. Call 911 right away if you're thinking you're having a serious reaction like trouble breathing.
Thiazide diuretic side effects are nausea, vomiting, diarrhea, rash, dizziness, weakness, headache, dry mouth, full sensitivity,
Thiazide may be right for you. For more information, call 1-800-PP. That is 1-800-PP.
All right, welcome back to Nursing Feud. I'm your host once again. We have Yeji, Daniela. So far, Yeji is in the lead by 1 point. So we'll see what happens in this 3rd round. The points are tripled. I'll go ahead and start with the first question. What would you assess before and after the administration of thiazides? Daniela.
So you would assess
before and after the administration, you would want to assess your patient's blood pressure, their lung sounds, their ins and outputs, intakes and outputs, as well as their heart rate to see if they're tachycardic. And yeah, I believe Judge is telling me that there's one more answer. As well as excessive thirst. Okay. All right. They say that that's correct. All right. Woo. All right. Question number 2. What lab would you monitor before and after administration of Thiazides?
So you monitor the electrolyte level, such as sodium, chloride, calcium, and potassium.
See, check you out. You're real specific. You must know your stuff. Okay.
And then you also want to monitor the blood pH and ABG,
Okay.
and the blood glucose level, and the BUN and the creatinine.
Survey says that that's correct. All right, AD, you get your triple points. Oh, darn. All right, Daniela. Caught up.
It's a close race.
Now you're slacking again.
By 1 point.
All right, so last question for round 3. What would you teach the patient about thiazide usage?
You would teach them to administer the medicine in the morning to avoid nocturia, and to wear protective clothing and sunscreen when exposed to the sunlight because it causes photosensitivity. And if you're diabetic, check your glucose level frequently and eat food high in potassium.
Okay.
We need to study together, AG.
We will.
All right. And that is correct. Yay, G! You are the winner of round 3. You're going to the fast round. Daniela, I'm so sorry. You have to go back to nursing school and repeat med surge. No. It's terrible. It's awful. But, you know, you just got to do better.
Oh.
All right, so welcome to Nursing Feud. Now we're in the fast round with Yeji. All right, you ready, Yeji?
Yep.
All right. So in this round, it's a little different. I'm gonna ask you all the questions. You'll have 25 seconds. Okay? You ready?
Yep.
Question number 1. How are thiazides excreted?
Through the urine.
Name the most common route for taking thiazides.
Oral.
How are thiazides metabolized?
In the liver.
How are thiazides distributed?
Through the body tissue.
Right? See? Questions out of the way. Let's see what your answers were, how they compare to the survey. So when I asked, how are thiazides excreted, you said through the urine. That was the top answer. Got 20 points. Okay, all right, okay. When I asked you to name the most common route for taking thiazides, you said orally. And the survey says, ding, ding, ding. That's the top answer. Oral, 22 points. Okay. You're so close. You can almost taste the nursing license, right? You can almost taste it. Okay, when I asked how are thiazides metabolized, you said through the liver. And I'm so sorry, no, it's not metabolized, so you lost 35 points. It's gonna be tough to come by. You know, you gotta get 150 to get that nursing license. So let's see how you do with this next question. All right, when I asked how are thiazides distributed through the body, you said through the body tissues. And that is the correct answer, but unfortunately it's only 32 points. Oh, so you don't win that nursing license. I'm so sorry, baby. Such a good try though. So sorry. All right, so game's over now. This is kind of the upsetting game we had a nursing feud today. I had Danielle and Yeji. They gotta go back to med surg and repeat. Couldn't get that nursing license. But you know what? Better luck next time. I'm rooting for you guys. Good luck with everything. I know you guys will be great.